Welcome to Mary McCorvey Experience Over Expectations podcast, which you can find on YouTube, Substack, and any place you find your podcasts. Be sure to subscribe today.
Welcome to Experience Over Expectation. Rebecca Lyons is joining us today, and she is a dynamic entrepreneur, a CEO, and founder of HerSay, an AI-powered health companion designed to empower women in navigating their own healthcare journeys. She's formerly a corporate strategist with more than a decade of experience in sales operations, digital transformation, and executive leadership. She transitioned from optimizing billion-dollar organizations to building an impactful health startup, all while parenting a toddler. And that is maybe the best story of all right there. Welcome to the program, Rebecca.
Thank you very much, Mary. I'm so happy to be here.
Well, tell us about a little bit more about your background and what inspired you to start a tech company.
Yeah, absolutely. So I've always been very interested in technology. My educational background doesn't really have much to do with that. I have a degree in psychology and resource management, but in high school I worked in electronics stores. So that thread sort of carries through. I started my career in the logistics industry, got recruited into sales and marketing, and really enjoyed that sort of business side of things. So worked that corporate job, developed a customer onboarding program we rolled out across North America and enjoyed that. My husband got a job in the Caribbean, so we moved there for some time. And when that contract finished, came back to Canada where I worked for a robotics startup. So that was sort of my foray into that really fast-paced startup experience. We were globally distributed, selling mainly into Asia Pacific, actually. So it was really interesting to get that experience working with people in different places across the world. Planned a trade show to Amsterdam, got to do lots of fun things. And then ended up back in logistics when that initial company called me back and asked me to come back to them. So from there, sort of built out teams across North America to support, did a lot of digital transformation. And again, that technology thread comes in.
Right.
And when I went on my maternity leave, I actually thought I may need to start to look into entrepreneurship. I started doing a lot of networking fairly early on because I knew that there was something more for me out there, and met a bunch of wonderful entrepreneurs, and that experience felt more in reach than I had initially realized. So my first venture I started up was Xera Solutions. That's an AI-powered analytics platform for human resource teams. But with the global economy doing a major shift here, businesses may be holding back on that investment into some B2B tools. I thought, okay, just take the foot off the gas a little on that, but totally not stop.
Well,
And
before
experience,
you go on, let me ask you this: how did you first use AI in your tech startup? How did you get drawn to that?
yeah. So artificial intelligence is something that is so much more accessible now than it has been in the past several years. I was starting to play around with it in my corporate role under a sales and marketing lens, building out some predictive analytics for the sales team. And when I went into doing that sort of same different application of the same process with HR at Xera, again, felt, wow, there's a lot of opportunity here. So artificial intelligence allows us to really speed along a lot of processes. Of course, we need to do a lot of fact checking and making sure we're doing this ethically. But by looking at trends over time in a piece of data that you have, right? Having a human look into that may be quite cumbersome and take a lot of time, where we can use AI to make that almost a immediate process, right? So I saw a lot of opportunity in using artificial intelligence for good, calling out trends in the data points and the resource teams have access to better support their workforce. looking at performance management as an example. If we can identify sort of where our performers are within the organization and then make actionable recommendations and plans to help them improve, we may end up with a more productive workforce while also empowering our employees to feel their best work. Just as an
Yeah, that
example
sounds
of
like a
that.
great application in HR.
Yeah,
So now
exactly.
you're taking a foray into
Mhm.
healthcare, and that's a
Yes,
completely different animal. So
yes.
you started out with when you went on maternity leave, you
Hmm.
got the entrepreneurial bug again, and it became more accessible to you. And
Yes,
how did you get to HerSay?
yeah. So I have undergone a relatively recent experience with being diagnosed with stage 4 endometriosis.
Oh my God.
Um, Not the best news to hear, especially as, a new mom, and but it really was um, validating. I would say the experience was validating. I've had many years of endometriosis symptoms that were misdiagnosed or undiagnosed, and we never really knew what was going on. I experienced chronic fatigue, abnormal bleeding,
Mm,
lots of pain, back pain, a lot of different things that, if you look piece by piece, could be influenced by many other things, but put
sure.
all together, 1 in 10 women suffer from endometriosis. And so it does make a lot of sense. And my experience
So
navigating
can
that,
you
sorry, go
please
ahead.
explain
Yeah,
what endometriosis is?
yeah,
Because a lot of people
absolutely.
in the audience may not get it.
Hmm. So endometriosis is a condition in which the tissue in your body that acts like endometriosis, or sorry, rather endometrial cells in your uterus, manifests elsewhere outside of the uterus.
Mm,
And so it's a very hormonally linked condition, with those ebbs and flows of the hormones. We see this process where bleeding happens then internally, and that doesn't have anywhere to go. So it builds up as scar tissue, unfortunately, throughout the
mm.
body, primarily usually in the pelvis, but it could be elsewhere. It could end up in even your elbow or your brain. It can go anywhere.
Oh my
And so
goodness.
that Yes, and that buildup of scar tissue not only is painful, but can cause additional conditions on top, right?
Right.
Usually impacting fertility, but definitely impacting many other things. So in my
Yeah.
case, my fallopian tubes and ovaries are adhered to my uterus with scar tissue. I have a complex cystic mass that continues to grow with every month as we go through those hormonal changes. Contributes to a lot of pain, certainly causes fatigue, but didn't know until, the past couple of months that that was what was going on.
Oh my
Um,
goodness. Well,
mhm. So
you mentioned that it was validating, and I can just imagine that, when you're experiencing these symptoms and it's very difficult to pull them all together or to even link them, having a diagnosis must have been, like you say, validating.
yes, yes, absolutely. There was a lot of question as to where my symptoms were coming from. And I
Sure.
think there's more bodies of research around this. There could definitely be more, but they're able to sort of look at, when they're doing an ultrasound, how your organs are moving when they're doing that ultrasound, to help determine that there may be scar tissue, because it typically doesn't present well on
Right.
imaging. So until it's in severe stage. So
Right.
in my case,
So
I happened to be
yeah,
there.
the
Yeah.
stages, you mentioned
Hmm.
that your diagnosis was stage 4, which
Correct.
indicates a pretty
The
grim
most severe. Yeah.
progression.
Yeah.
Um, where where are you now? Have you
Yeah.
been
So
treated?
not, I haven't undergone any treatment for it at this time because it's been relatively new. There's different bodies of research showing pros and cons of laparoscopic surgery. Again, it kind of depends on where it is. Some
Hmm.
say, maybe that type of invasive treatment where, I have some adhesions, may actually cause more harm than good in some cases. Other bodies of research show, well, it can relieve your symptoms. So it really depends on where you're at on the scale of discomfort. and where where it is in your body and all this stuff. So in my case, because I'm not so severely debilitated by it, I still have some, fertility stuff that we're working through. Not looking to make a drastic change with surgery at this point, unless we do find a correlation in impact and other things. But there is options for women who do have this condition. If you're experiencing some symptoms of endometriosis, I strongly recommend that you reach out to your practitioner to talk about what those options are. Growing research in diagnosis as well. There's some blood test type work that's being done to try to diagnose with a blood test. So again, non-invasive in comparison to previously, they'd have to go in with laparoscopic surgery to diagnose. So lots of really great stuff going on. And once you know where you're at, then you can develop a treatment plan that works for you with your practitioner.
Right. And am I correct in kind of jumping to the point where you got the diagnosis, but the process that you went through to, in addition to the symptoms that you were experiencing and continue to experience, took you to the place where you said, you know what, women really need to have more of a say in the process of their health care. Is that, so I jumped to that. Why don't you tell us about that and how you got to HerSay?
Yes. So I'm very fortunate. My family doctor retired, and it was a stressful time because I had a newborn baby and I needed to find a new primary care provider. And that is a big challenge, I think, probably globally at this point, but certainly in Canada. I've heard in the US as well. Um, so I reached out. There was a nurse practitioner recruiting patients in the area. So I thought, well, let's try that. And the model of care has been incredible. So I had been experiencing these symptoms. I spoke with her about my concerns, and I actually said, I've been doing some research, and I think this might actually be endometriosis. And instead of really discounting my experience and saying, oh no, like that's 1 in 10 chance, like there's probably not, she was very validating and said, let's test that theory. It, based on what you're explaining, it very well could be that. We should go with that until we disprove it. Completely different experience than I had ever had with a medical professional. So there she ordered that ultrasound test. And again, unfortunately, because I was so advanced in the stage, they did find it on an ultrasound. Normally you wouldn't. Um, so we were able to then make a plan for future treatment and making the options available to me. She was incredible in explaining that. So everything I've relayed to you, I've learned from her, right? The process of how diagnosis works here in this day and age, what my options are for further diagnosis and treatment plan, what may work best for me based on the recommendation based on where I'm at. And here are some other options if she feels out of line based on what my understanding is. So that was really an incredible experience. And I felt, how can we get more women to know and understand that this type of care is available to them, right?
Mm-hmm.
You're allowed to ask for what are all my options. You're allowed to ask for a referral to a specialist. You're allowed to ask for a second opinion. Like there's sometimes it depends on sometimes the personality, but many of us brush off our own symptoms because we're so busy. We're the caretakers in our world. We're potentially taking care of children, partners, parents, family around us, friends around us. And we tend to forget ourselves. And when we do have the time or the courage to bring up our concerns with our practitioner, sometimes I think because we're carrying on with life as business as usual, it can appear as though our symptoms aren't as severe as they are. And that may also contribute to that mis and underdiagnosis because we're not debilitated by it. We're continuing and pushing through, but really what our experience is quite, would otherwise be quite debilitating, right?
Right.
So yeah, trying to bring that to
that
others.
took you to that was your inspiration point.
Correct. Yes.
Well, there was a lot of between then and now. So,
Mhm.
what does HerSay do
Yes,
for women and
yes,
those of us that want to have a greater say in our healthcare?
yeah. So HerSay helps to facilitate positive patient-practitioner relationships. We're an AI-powered health companion that supports women's advocacy. So you would track your symptoms in the app. It would identify trends in those symptoms all the time and recommend speaking points with your doctor. A difference between using the app and having that conversation would be that you have data-based points to talk about. I logged fatigue over the past 2 months at a severity level of between 6 and 9. I am severely fatigued and it is impacting my life. Is a very different conversation than I've been kind of tired lately,
Hmm.
right?
Right.
So trying to give women that empowerment of validating their own symptoms to themselves, validating that to the professional, but then also giving the professional the information they need to make that diagnosis and to recommend that treatment plan, right?
Hmm.
Yeah.
Absolutely. So, I am a user of HerSay, and I'm experiencing chronic fatigue and back pain. And
Hmm.
sometimes I'm experiencing abdominal pain.
Yeah.
So these are very vague symptoms,
Hmm.
and I put them into her say.
Hmm.
And what I receive back is possible options of what it could be. And then there's also the references to so that I can go and do further research about because it could be endometriosis, it could be cervical cancer, you
Hmm.
know, it could be a
Yeah.
number of things. So the your app provides additional resources for people. I'm telling you about your app. So because I'm looking for what the components of it are. So
Hmm.
why don't you tell me?
Yeah, absolutely. So at this time, we are not a diagnostic tool. I want to make that very clear because it's really
Okay.
important that you consult with a professional, a medical professional, to get a diagnosis. But what we do is help women understand what's going on with their bodies and explain those symptoms in a way that the provider can understand. So though we're not making diagnosis at this time, that would be a
Oh,
longer path, right? We would be able to help facilitate that. And so I don't want to alarm people in that, oh, this could be endometriosis. This could be, because we can go down that Google rabbit hole of, oh my gosh,
sure.
like it's the worst case scenario. What we're trying to do is validate that things are happening. This isn't your normal. We need to track this over time and let's have that conversation in a way that's going to get you an
Mm.
answer, right? Get you a treatment plan so that you don't have to feel this way. We want everyone to be feeling their best at all times, right? So we're going to support that journey through to diagnosis and treatment so that women are empowered in that journey.
So after I first go into HerSay and I
Mhm.
experience the app and I get information that will be helpful to me with my doctor, and then I go to my doctor and then I get diagnosis, I
Mhm.
come back to HerSay
Yes,
for,
absolutely. So there's often a treatment plan that's recommended by a provider, right? So in the experience of that back pain, right, of that abdominal pain, they may recommend changes in your diet. They may recommend certain medications. It's important that you track how you're feeling on that new treatment plan so that you can know if it's working or not for yourself, but also to give that feedback to the doctor, right?
right,
Um, it can be a little bit difficult for us to tell, oh, how am I actually feeling the same as before? Is this not working? I'm just
right,
used to that. That's my new normal. Or no, I've noticed a significant improvement. This is working for me. And then again, over time, checking in periodically because things in your body change. And so that treatment plan may not work for you 2 years from now, or 6 months, or 2 months from now. And you
right.
may need to look at something else. So having that timeline of what's going on and the AI having the ability to tell you, hey, you've been logging things that don't feel really good right now. Like you may want to go back and have this conversation. And here's what you're talking about. You're telling me you've got this pain coming back. You're telling me that you're having this abdominal issue continually. That treatment option doesn't seem to be working very well. Why don't you have this conversation, right?
Mhm. So, did you develop this platform yourself using AI?
So that's a really good question. I really love the ability that we have now to use those no code and low code tools. I did use AI to develop my prototype, but took it to an actual developer to move through with the entire app sort of build out and make sure that not only is it scalable, and we've got the user support that we need in place, but also we want to be HIPAA and PIPEDA compliant with regards to people's data security and all of that. So
Right.
really wanted to make sure we're storing data in the right place. We're encrypting that. We're making sure that we're compliant. So had that professionally developed. I do have a co-founder that I brought on who has experience in the med tech industry and navigating all of that. And she's been an absolutely wonderful resource in making this come to life as well.
Well, let's talk a little bit about your entrepreneurial journey. So, as I mentioned to you before, I've had the same type of journey where I've founded companies and taken them to execution and exit. So I'm familiar with that path. What is it that you would share with prospective entrepreneurs about that journey?
Yeah. I think the number one thing is just start. We get
Mm-hmm.
really in our head about trying to have the perfect idea or the perfect um, market to go into, the perfect everything. And it's never going to be perfect, especially with your first venture, right? I mentioned I built out Xera Solutions, still continue to build that. But given where the market's at, we may need to pivot. I'm building this HerSay. This may not be my be all and end all. We'll see how this goes. We are getting wonderful feedback from the market on it, and I really think it's going to be a thing. But it may not be my forever thing. I don't know. It may be. And so, not to be discouraged by um, um, constructive feedback, maybe I'll put it lightly, but failure, right? You need to kind of fail fast, and you need to just be open to that pivot. Um, Another thing I'll say in line with market testing is before you start building, test the market. And what I
Mm-hmm.
mean by that is have a lot of conversations. So before we did anything on development, I talked to over 100 women in their experiences navigating the healthcare system. I tried to be as data backed as possible in this build. I took actual feedback from these women in developing that platform so that it's serving their needs, not just what I think are their needs. So, um, beyond just starting, talk to as many people in your target market as possible because I think they'll give you the answers that you need in order to build something successfully.
Mm-hmm. That makes a great deal of sense. So tell us about your minimum viable product.
Yeah. So minimum viable product is bare bones. We actually peel it back without even having AI integrated to start. At the very basic, we're tracking symptoms, and then we're using just really basic data analytics to track trends over time, right? Before we start to get too involved with AI, we want a repeatable, scalable framework because AI works best in that type of scenario. So from there, we implement user feedback, right? And we add on that AI layer to start to train the model on exactly what we want. And then we would go to market post um, feedback and post feedback, right?
Mm-hmm. So you're in the market now.
Yeah.
What level of platform do you have? Is it 1.0?
Yeah,
Is
yeah.
it
I would call it probably 1.5, 2.0, right? So we're in
okay?
that stage where we've got user feedback that we're integrating into the product actively. So it's not like we're just big question mark. But we intend to iterate on the product as much as we can to best serve our users, right? So still relatively early, but but definitely going to market with something that we know our users are asking for.
Excellent. And how did you self-fund this, or did you get investors?
Yeah, so from an investment standpoint, I because we're not a medical device company, and because we have some connections on the development side, we are bootstrapping this at this point in time. Certainly not close to investment, but want to make sure that we have the right partners to go on that journey with us. We want to make sure that the resources available to us really align with our vision of supporting women's health and getting as many people the care that they deserve. So right now, bootstrapped. We'll see if we raise. Still to be determined.
Mm-hmm. Well, that's a very interesting part of the process for sure. And if there are potential investors that are interested in HerSay, they can certainly reach out to you because
Absolutely.
you have something that is unique in the field. You have done your market research, you've identified a market gap, you've built to the market gap, and now you're going out.
Yeah, that's right.
That's true.
Yeah. Yeah, that's exactly the journey. Yeah.
Okay, that's what I was saying. It sounds very familiar, and
Yeah.
it's a great journey to be on. How can people reach you? Is it hersay.com?
It's hersay.ca. We are based in Canada. So
Okay,
www.hersay.ca for now. And then on the App Store, in this HerSay.
okay, great, great. What else would you like to share with our listeners and our viewers?
Yeah. So I think for those who are navigating invisible chronic illness, know that every day is just a day, it's temporary. I know it can be easy to draw comparisons and say, wow, how are you building this while going through this sort of debilitating invisible illness? I don't do 100% every day, all day, right? It's not possible for even a fully healthy human to do that. And you shouldn't. You need to take care of yourself. So give yourself a lot of grace. If you find inspiration in what your experience is and you want to do something entrepreneurial with it, just start. Start by talking to others in that community. But otherwise, yeah, I'm hoping that we can reach enough people and make their experience in the world a little better with what we're building.
Wonderful. Well, thank you so much for joining the program today. Rebecca Lyons, CEO and founder of HerSay.
Thank you.
You've been listening to Mary McCorvey's Experience Over Expectations podcast. Be sure to subscribe today on YouTube and Substack, or listen wherever you find your podcasts. Thanks for tuning in.